Mute.
Good morning, everyone. This is Donna Robertson, and welcome to an early morning. I am now in Central Time. I am in Alabama, so this is 8 o'clock for me instead of 9 o'clock. So hope everyone has some coffee or whatever you need to stay awake. I feel like I've got some good information that you can take and use initially. Basically, the reason why I wanted to give this at this time, because going through all the emails and phone calls this past year, these are a lot of questions that I've received from a number of the franchisees. And I put this together for you, and I feel like that it's very important and informative, and I wish you luck. If you have any questions, please feel free to ask at any point. But you're at the webinar to improve awareness within your community or my community. Suggestions, we're going to talk about suggestions in focusing attention and improve your exposure. Improve your exposure is one of the main areas that I want us to concentrate. My feeling, and I've put this together through my years of experience and in trying to promote and educate Pedorthics within the state of Alabama, and then spread to 28 states. But as you know, I was on a mission, I'm still on a mission to help in education Pedorthics. So going to the customer, I feel like was a primary source for me in starting up my practice and in trying to gain client intake or people coming into my business or enhance my referrals. Customers, to me, this is the best possible resource of the business. And I'm sorry, I just saw a misspelling. Please forgive me. I have been at the hospital with my niece, expecting her first child, and she is in very critical health at this time. So please keep her in your prayers. But we'll go on. So just look over some of the mistakes that you see. I wanted to talk on which areas to focus on and what the needs of those areas are, and how you fall into the role of a Pedorthist within those medical areas or resources within your community. Also, one of the questions that always kept coming up from Fit Solutions franchisees is, how can I be more serviceable to my community? And to me, Pedorthists should be a part of the multidisciplinary team within the medical community. But we're going to talk medical, but we're also going to talk about just what is available to you, not necessarily through the medical community, but through you as a number of social events in your area that can be very, very productive for you and your business, your practice. Let's talk about with the continuing education accreditation. I have to give an explanation of exactly what I'm focusing on and what certified Pedorthists, their activity within this realm of focus. Also, before I go any further, for continuing education, there is a 10-question test, and Betty has access to that I've put together. All you need to do is contact Betty by email and have her email you the test, take the test, and in order for you to complete your requirements for gaining the CEUs for this course. Certified Pedorthists who begin a practice should know every aspect of Pedorthics. Now, you that have known me over these past 3 years, I am a believer that education is the key to enhancing your practice. I feel like you should know every aspect of fitting, of shoes, which I feel like that you do, but there's always something more to learn. Please don't close the door on enhancing your knowledge and more insight to all the technology that's available to you. Custom shoes, shoe modifications. There's a lot that I have noticed especially this past year in doing some regional meetings where I'm actually coming to your site. The uncomfortable feeling of stepping outside of doing or outside your comfort zone as far as doing certain types of shoe modifications that are very simple for you to do within your practice that will give your patient some positive feedback and also relief of pain at that time. So I will be talking about that when we talk about specific shoe modifications that we're going to be doing this year. But also I want you to be aware of all the orthotics, all the types of orthotics that will come through your practice. People will have on their feet, or they will have a bag full of orthotics that did not give them any relief, or that was completely uncomfortable, or that they were completely closed-minded on introducing this orthotic management into their daily activity. I feel like, and with that, there's so many different types of materials that you need to understand the technology and the function of those materials. And I feel like this is something I need to focus on for you this year, is all the different types of orthotics, because when you go out in talking to physicians, they may be using a different type of dynamic of an orthotic, a makeup of an orthotic, different types of materials, and I want you to be educated on those so that you can communicate with that physician as to how they actually work, why is this not working, what you can do to help change the positive outcome of that orthotic function. You need to know the majority of all pathologies related to your area of specialty, okay? And I'm talking actually from the waist down, but there's a lot of other pathologies that is so related to the function or the dynamics of the feet that you may see more symptoms in other areas of the body. And I'm going to mention some of those. You need to provide the best services for their patients that is referring to you. They're either physical therapists, athletic trainers, occupational therapists, home health, or the physician. But always try to provide the best service that you can do for their patients, which are your patients, your clients. Let's talk about, just mention some of the pathologies, and I can send all of the list of these pathologies. What I would like for you to do for you is to take these. Now, I could take these and give you, talk about the whole definition of this pathology, but I didn't want to take up a lot of time on really the scope of this presentation. But what I would like for you to do is for you to research this topic and see how it actually relates to your field and also relates to how you would market to anybody involved in this field. And we're going to discuss how some of these areas actually breaks off into other functional social activities within your community. Just this, let's say people with just osteoarthritis. There's dinners, there's so many things that comes from different functions of that group, and we're going to look at those as to how some of those connections actually enhanced my patient load within my practice. Diabetes mellitus. You need to know peripheral neuropathy. Who actually is concerned within the medical field about peripheral neuropathy, who actually talks peripheral neuropathy. Vascular impairments. Ulcer. You've got to understand, too, with vascular impairments, don't think, oh, she's out in left field on this. I want you to think with vascular, we're talking vascular surgeons. With vascular surgeons, most of their surgical time that they're on their feet themselves is a maximum of 8 to 12 hours at one given time. These are people that we want to help. These are physicians that will lead to other physicians in related fields. So just think, you're not necessarily talking about varicose veins. We're talking about vascular deficiencies, anything involved in that. Restless leg syndrome. There's so many things that you can do with the shoes, the technology of the shoes. If someone has chronic swelling within their ankles and they have a pooling of the main femoral artery at the popliteal space in the back of the knee, if you have a negative heel in that shoe, and that's all that's built into that shoe, such as earth shoes, that can cause more swelling in the posterior aspect of the legs. See, a lot of times people don't even think about this, but this is what I want to encourage you to search out, learn from, so that you can introduce your profession to vascular impairment groups. Because if you have more than or at a minimum of 5 degrees of a rock toward the forefoot, it acts as a pumping action of that lower leg. All of your vascular medical realm is very interested in that for their patients. That is one topic you could actually just talk on to a number of medical forum groups. Ulcers, Charcot foot. Let's talk about rheumatoid arthritis. Rheumatoid arthritis of just the metatarsophalangeal joints. Rheumatoid arthritis of just the tarsal joints. There is physicians that actually like to just specialize in these areas. There is physical therapists that like to just specialize in the treatment of these areas. And you'll notice that a lot of our professions are branching out and actually specializing. You won't necessarily see it in the yellow pages. You'll see it more in medical magazines, osteoarthritis, rheumatoid arthritis, or national RA magazines. Find out who these people are. I research these people, and I get to know who knows that person in my community because it's an interest. I would like to talk to them. And I'm not afraid to pick up the phone and talk to them, okay? So make these contacts. Anything with osteoarthritis, there's a number of organizations now that are very involved in the osteoarthritic support groups, social groups, meetup groups. Other arthritis, such as psoriatic, gouty, fibromyalgia. Fibromyalgia is one big group that if you just go and attend a lot of their activities or submit an article that you have, maybe someone's come through your business, they've had fibromyalgia, you have a positive testimonial from that, send that in to that group. Send it in to the National Association. It does not hurt to branch out, and that is exposure for you. Let's talk about osteochondritis, which is the interdigital, or not interdigital, but the cartilage within the two bones, such as the knee, the ankle, or the forefoot. Freiberg's disease, Kohler's disease, Osgood-Schlatter disease, syndrome. That's more of an adolescent characteristic, and that Osgood-Schlatter is right at the inferior patella aspect of the knee. So it's anteriorly, but it's at where the patella tendon attaches to the tuberosity at the tibia. And we have found now, over years and years of evaluating and researching this diagnosis or this disease, that your feet are playing a big part as to the degree of symptoms. So, and I have a number of case studies that I have just kept up over the years of children that are beginning to have this type problem. Or I may be seeing them for a foot problem, but I always evaluate from the knees down, which you should always too. The Legg-Perthes disease, Sever's disease syndrome, hammer toe, claw toe, mallet toe. Okay? Some of these characteristics can actually be related to other pathologies, not just directly of a foot or a toe trauma or an environment of the shoe or the foot within the shoe that is unacceptable. This may go along with some of the pathologies, such as Crohn's, such as Sjogren's, so because of the contracture of the tendons. But if you ever get a chance to go and talk to a Sjogren's group, support group, or Crohn's support group, these are things that you would include in your presentations because they're more prone of tendon contractures. Scleroderma, that would fall into this group. Crossover of toe deformities, yes, that falls into the group. Bunionette, Taylor bunions, that would fall into the Parkinson, okay? So these are types of topics that you would actually talk to them if you go to or have an opportunity to talk to the support group. It's not necessarily you're going to talk about Parkinson's. You're going to talk about the Pedorthic approach in the care of a Parkinson patient, okay, which these are the characteristics they would have. And intractable plantar keratosis, just hard corns or calluses, plantar warts. Plantar warts goes along a lot with some of the viruses that actually show up in the feet. So I'm mentioning hallux valgus, bunions, sesamoiditis, turf toe, metatarsal phalangeal joint, the synovitis, which goes along with rheumatoid arthritis. And this is very painful for a lot of your lupus patients, your rheumatoid patients, your Sjogren's. So don't think, well, if I get a chance to speak to the support group, what would I talk about? These are things you would talk about, and I'd be glad to help you if you get an opportunity to speak to a support group. And they are begging for people to come and help educate them on simple things. And to them, just their feet is a simple part of a lupus patient, which is actually not to us because we want to keep them as mobile and as active as possible. Stress fractures, people with, beginning of osteochondritis, bone breakdown of calcium. Stress fractures do happen a lot with pregnancy, especially in the third trimester. So these are things that you can actually focus on in presenting to them or to communicate to the doctors, to the nurses associated with that medical team. Fractures, accessory navicular, we see this a lot with young or adolescent patients, but we also see the outcome of an accessory navicular with a 40-year-old, a 60-year-old, because it does affect the tone and the function of the posterior tibial tendon. So if they've always had an accessory navicular, they've always had a callus effect in that area, but now they are feeling more weakness in the medial arch, shuffle of their feet. We're seeing a lot of this with your Parkinson patients, with that Parkinson shuffle. And I had the opportunity to speak with or to a Parkinson support group, and these are some of the things I address. What type of shoes is best for them? But I also evaluated each person's foot that was in attendance with the support group. So if you want the list of all of these, don't get overwhelmed with all of these topics. Take these. Maybe you might do one topic a day or one topic a week. That's fine. But acquaint yourself, okay? Be able to communicate in these pathologies, okay? Retrocalcaneal bursitis, perineal subluxation. There's a lot of diseases that you will see perineal subluxations more active in, and especially with stroke, head injuries. We always look at the stability of the perineal tendon for the lateral support of that foot during function. Patellofemoral pain syndrome. Yes, this is about the knee, but this is a topic that is of a concern, and when we start going out, I start breaking down a lot of groups that's very active in your area, meet-up groups, some of the things that you would discuss, okay, patellofemoral syndrome, and how you, as a pedorthist, balancing and working with the feet can decrease symptoms and eliminate the symptom. Chondromalacia involves the patella. It's a softening and deterioration of the cartilage, the hyaline cartilage behind the kneecap. That's chondromalacia patellae. Okay, just glancing on down, Charcot-Marie-Tooth, post-polio syndrome, Parkinson's disease, CP, MS, MD. All of these diseases or symptoms, not actually symptoms, but groups, support groups that you need to be involved in. Okay, there is a support group for amputations, individuals with amputations that you need to be involved with. And when I say involved, we're talking about socks, shoes, bracing, for the non-amputated leg. So these are because a lot of times the non-affected leg is neglected, and that you've got to support the unaffected leg for long term. Leg length discrepancies. We need to be involved in adolescent issues during school screenings. You need to be talking to School Nurses Association, going in and doing a presentation for them, not necessarily talking specifically about leg length discrepancy, but talking to them about certain issues about their feet and how they're up on their feet consistently, the types of shoes they wear, enlighten them, educate them on pedorthics. But also, whenever they have a child that they have screened with severe scoliosis, that way you would be brought in as their team approach for that patient in contacting with the orthopedic surgeon, neurologist, the pediatrician, and then that leads to more resources and contacts for you that enhance your awareness within your medical community, but it will also enhance your referrals. So as a pedorthist, I never want you to forget, you have to engage your customer. Engaging the customer within your evaluation process or within educating them on their diagnosis. If you can't talk to them about the medical aspect and the outcome or what's going on with their, let's just say, scleroderma diagnosis at this time, then you lose credibility. That's why you have to be able to educate yourself, understand the diagnosis or the syndrome, and engage your customer as far as why you're going with this type shoe, while you're going with this type of support, whether it be your function and your activity. And that leads to building trust. Building trust is the key. And you that have been in this, and you'll say, well, I've heard that many, many times. That's true. I do that. That's true. But it's always good. Every day I've concentrated on building trust within my community. New, updated information. You have got to be aware of what's going on. Don't get burnt out on thinking, well, they're all the same. You know, each material, I've seen different types of materials. Acquaint yourself. Get samples of that material, where it's related to your field or not. I always liked feeling that material in hand and knowing why is it being used. That way, that opened up more communication lines between me and the medical personnel. So wanting to know all of the over-counter insoles, don't just know what you as a Foot Solution franchise carries, but know what's out in your community and why are they investing into that type of over-the-counter, okay? New materials, new technology. Stay abreast to all of that. Follow up letters to your clients and referral source. That is critical. A lot of times you say, well, I'm just too busy, but this right here, just by following up, taking time to send a letter to the client that you have just seen, and also to the referral source, whether they directly referred that person or not. If they mentioned your name, and a lot of times through my evaluation, I would talk to the client, the patient, and ask who all has been involved in your medical care. And, I might say who has mentioned my practice, Pedorthic Care Center at that time, who has mentioned Foot Solutions. I may contact that office or that person or that friend and talk to them further about any other type of connections they might have, but getting information to them and letting them know, thank you for using my name. Ensure critical follow-up. This all will ensure critical follow-up. Follow-up is the key to building trust, okay, to sustaining that trust, and to enhancing more open communication with that customer, that client, that patient, and that leads to more awareness within your medical community or within that support group that they are active with. One thing that I always did, too, is the top referrals, no matter who it may be. It may be from an athletic shoe store that referred so many patients that month. It may be that top orthopedic surgeon. You only need one good orthopedic surgeon. That's all you need. If you've got two referral sources within the medical community, you can build from that. Believe me, I have done it, and I know you can do it. I kept a count of exactly how many referrals I saw that month from one given group. It didn't matter who referred them. I kept that list. If it was from Jane Smith, and it was, it may be a community leader, it may be a minister, or I kept up with that. Now, yes, I did spend a lot of time with that, but I knew I needed that basis to start building from. When I started up in Pedorthics, when no one even knew how to spell Pedorthics, much less pronounce it, okay? So please keep an open mind on this. Don't shut me down. Don't say, well, I've done all that. Please, I want you to go back. Let's look at this again, because every time my patient load decreased, I went back to my resources. I went back to my list. I would sit down in my spare time When it was down, I got on the horn. I contacted people, went back to my old resources, my referral base, and contacted those people. What's going on? I just wanted to let you know I'm doing some different things. I have seen a number of post-polio syndrome groups with a lot of perineal paresthesia, and this is a topic that I would like to spend a little time talking to you about just for a minute and get their ideas, include them, engage them in some of your concerned topics, okay? But I sat down and I got with it as far as trying to get people in. No, I wouldn't see immediate results, but I knew within my heart and within my profession I was doing the best I could at that time. Concentrate on lasting, quantifiable, and strategic value of your relationship with others. A lot of times I just kept a list of patients that I knew that had, or people that I have met. I would keep their cards, articles that I read of community magazines, maybe in offices, in restaurants. I looked at everything I could get my hands on. And I would cut out those contacts. That would be my source that I would go to in trying to build new relationships. Okay? So strategic value of your relationship with others is critical. You need to focus on building and strengthening your relationship with physicians and other referral professionals. Being also in the medical community and starting up, I know that this one focused on building and strengthening your relationship. I was already having some contacts with the referrals, with the medical community. And concentrating with strategic value of relationship with others outside of that medical forum proved to be very priceless for me. If I concentrated on just trying to get into that physician, a lot of times seeing that physician one-on-one is not the best source of contact. Getting to know everyone around that physician proved to be very beneficial. Recognize the value of relationships, taking ownership of individual roles, and working toward creating experiences with others. If you're not getting referrals from one medical group or physician group that's close to you and you're thinking, well, they're just right down the street or right down the shopping center, they should be able to refer. What is it I'm missing? You need to close that gap. Expose yourself. Get yourself out in front of them. And word of mouth is the key. If you're in front of a group, support group of the profession they work with, all that has to happen is for somebody, their patient, to mention your name in a positive manner. Believe me, within the medical community, they're always looking for someone that they feel like treats their patients well and will represent the profession well. So put yourself out there. Go for it. Find a mentor. This is so important. Find a mentor within your community. Don't think of them as a competitor. I used so many people in the related field that you would look at them, you would think from the professional point, hey, I'm in competition with them. I can't have association. That is so wrong. Please hear me on this. That is wrong. Open yourself up, okay? Open your heart up. Let's see what we can gain from this. Certified pedorthists must keep current with all the new studies, techniques, and materials. They may be a pedorthist, they may be an orthotist, they may be a pharmacist that is dispensing, diabetic shoe wear or diabetic insult. Find out what everybody's doing, but don't condemn them. Don't go on the defense with that. Try to find out where they're coming from. Understand their level of education. How can you intertwine? How can you network? Not necessarily that you want to be a part of that, but you want to recognize them as a profession. It's a sense of respect within your community. I will tell you this experience. I was not, when I was in private practice, my business was called Pedorthic Care Center in Birmingham. When Foot Solutions first opened up, one of their franchises close to me, I welcomed him contacting me, or vice versa. I think actually I contacted him and wanting to see, welcome to the community. Listen, you don't have to worry about, is there going to be enough people for me to see? There is plenty of people that in all of different pathologies that need your expertise, your help. So keep that in mind. But I contacted him. He came over, sat with me and my staff one early morning. He brought some donuts, or actually I think I had the donuts and coffee. And he had a little PowerPoint presentation telling me about what Foot Solutions and how we could actually work together. So I referred a lot of shoes to him, but he also knew that if a patient came in with my orthotic, that I wanted him to communicate with me. Let's work together with this. It doesn't mean that my orthotic's better than yours or yours are better than mine. We're all trying to help that patient, and it's better for us to work together. So don't be afraid of your competitor. Welcome your competitor. But find, and I used a lot of my resources that seemed to be in competition with me as a mentor. Believe me, I did. And they all still respect me for doing that. Call other pedorthists around the country and see what works for them. It doesn't mean that you have to stay within, your group or your franchise group. Find out in your community what they're doing. Talk to them. Get to know them as a person. We're all trying to live life. We're all trying to do the best we can. Know your community. Know what's available within your community. You cannot be all things to all people. Do what you do best and do it to the best of your ability. That's what I challenge you. Understand what you don't know and learn about it. That's what I push you, I urge you to do. Please do that. Ask questions and continue your education, both in pedorthics and business management. Believe me, I had no business education when I started my practice. It was just something I felt led to do, to be a part of the medical community and to help people in my community. I wanted to make a difference in people's lives. I had to learn the business through the hard way. And believe me, I learned it the hard way. But I was open to change. I saw the mistakes I made, and I reached out for resources within my community that was actually competitors to help me. Take care of business. You have to know your referral base. Build a solid business plan. Building a referral base is a big part, and you well know this, of having a successful business. Work hard to build relationships with many doctors, nurses, nursing homes, home health services, or any other allied healthcare professionals you can find. Attend professional shows and health fairs, even if you can't pay for a booth, or let's say they've closed. They have no availability for you to be able to be in a health fair. I always went to that health fair and talked to the people that participated because I used them as my connections to a lot of their resources that was out there. So if I wasn't invited or if I was not able to participate in that expo, I went. I didn't care. I wanted to know what was going on within my community. Speaking engagements, you've heard me say this from the time you've known me. are always a big resource of referrals, whether it's to other healthcare professionals or to a target audience. And I'm going to talk to you about that target audience. Train your sales staff on how to enlighten customers. This is not just for you as the owner or as the Pedorthic. This is your sales staff. Challenge them. Have goals for your sales staff. Make sure that they know how to enlighten the customer, engage the customer, both doctors and consumers, in the value of Pedorthics to improve foot disorders and enhance their quality of life. You do not want your sales staff to be out on the floor and you're with Joe Smith over here on the right, and then all of a sudden, Dr. Bill Russell, the top orthopedic surgeon, just happens to walk in, and your sales staff is with them. But he does not have a sign on that he is the top orthopedic surgeon. And all of a sudden, your sales staff is talking about going fishing yesterday instead of focusing on his needs. Okay? Know your sales staff, enlighten them on the complete approach. The best thing is through education of the pathologies and the seriousness of what their job is. Okay? The value of Pedorthics to improve foot disorders and enhance quality of life. Educate on the services offered and how the services would help. As is true today, consumer word of mouth drove a lot of my business. That, I have to say, that was probably 40% of my business that I knew that was always going to be there, because my clients, patients, knew I gave them all I could give them. I was there to try to help, and I did my best. But I involved them with everything I did, and I involved their complete medical team. Listening to the patient is very crucial. There has to be a high level of confidence between the patient and the practitioner. That's the key to success, because you want that patient or that client to come back to you, but you also want them to talk about you at a party, a dinner, whatever. You want to come up in some form or fashion. I would always have patients say, your name came up the other night at a dinner. I've gone over to some friend's house, and we were just talking, and your name came up. That's why I'm here. I wanted to see if you could help me. Put yourself in the patient's position. This is so critical. Take time to get to know the client. You have to know their concerns, their shoe style, what they wear going to church, the pain they are experiencing, but you've got to understand the pathologies to be able to communicate with them and to be able to be a part and be recognized as that medical support group. Work toward that main issue and try to accommodate the patient the best you can. Build customer awareness through so many contacts. If you have a good relationship with your physician in the area, it may just be one family practice physician. You understand him, and he understands you. That makes you the Pedorthis, an extension of that physician's practice. Please respect that and keep that in mind. But take that to heart and use that to your benefit. If you don't treat the patient right and give them what they need, that reflects on the doctor. And believe me, you're going to lose quickly that doctor. So keep that in mind. Recognize, and I would always keep up with what happened to Dr. McBride. He has not referred anyone to me. It's been a month. It's been 2 months. Has he moved? What's going on? Is he sick? I would contact his office, find out. Talk to his nurse, leave a message for his nurse, or either talk to the office manager. Just say, I'm just concerned. Dr. McBride has always referred patients. I just wanted to check and see if there's anything that I need to know or are you focusing on different types of patients or needs? I kept the yellow pages on my desk all the time. I knew in the medical community, I started out when I was going down and looking to see who do I want to network with. Orthopedics, rheumatologists, physiatrists, DOs, podiatry, endocrinologists, family practice, wound care centers, chiropractors, physical therapy centers, nurses associations, diabetic educators, wellness events such as health fairs. I know the VA has a health fair every year. The VA, if you have a VA that's close to you, hospital, I urge you to get to know some of the leaders within that VA system and get to know what they offer and how you can be a part. Now, a lot of VAs may have contracts. They may not. So be it. If they have a contract, hey, that's fine. Get to know who is involved in that system. Event guidebooks and resources. Event calendars. It didn't matter who this was. You know, if it was church event calendars. I wanted to know, is there anything talking about weight loss? Is there anything talking about wellness? Anything that was talking about let's meet and walk. Let's meet, walk, and pray. I was there. I contacted who was involved. Did they need a speaker? Could I come and join? And it gave me access to get to talk to people within my community. I always kept a business card collection. I loved taking those business cards, not mine, but receiving business cards. It didn't matter if they were in construction. You know, if they had, you know, I had a couple of patients that come in that owned a construction business or a landscaping business. They would give me their card in hopes that I would use them if I needed anything, but I kept that card also in hopes that I can contact them and check on them, and are they involved in anything in the community that I need to be aware of, that I can be aware of, and to enhance my practice or to enhance the education of Pedorthic. Okay? Newspaper articles. I had a stack of different types of newspaper articles, and I would contact a lot of those authors and get to know them in their community. Who do they work for? You know, what do they do? And that's not medial, it's medical forums. I wanted to mention this. There is so many. If you go to www.meetup.com, there is so many activity events that you need to be involved in. It is phenomenal. When I went to this, there was probably 250 different types of meetup activities. Club meetup groups, okay? Oh, let me go back to meetup activities. This I did do at one time, and you're probably going to laugh, but in one of the meetup activities in Birmingham, Alabama, is a stitching, they made quilts. And these are a group of 25 women that, actually there was one man in there, that they sit, you know, for 6 and 7 and 8 hours. You know what I talked to them about? That actually came, they had lunch, they would bring a dish and they would have lunch. And I said, how about I come and just talk to you, you know, for 15, 20 minutes. And those that are interested do foot evaluation. And I went to that stitching, quilt stitching group, and I met some of the neatest people. I gained so much information just from that group of going and having lunch with them. I didn't have to take lunch, nothing at all. I provided them some education on why their ankles are stiff after they get up, what to look for if the right ankle's swelling or if the left ankle's swelling. You know, why do you wear support hose? How many in here wear support hose? What type shoes do you wear while you're stitching? You know, why is it important to have shoes on and not to have just a flat house shoe? You need that support to aid in that circulation process while you're sitting. Remember, your knees are bent, so there can be a lot of constriction of blood flow at the back of the knees. So don't be closed-minded. I said that for you to open up your mind about this. There's club meetup groups, a Healthier You meetup groups, Anytime Fitness. This is phenomenal that you have right here, and I challenge you. Make a note of this. Now, you know that you'll be able to go back and hear this presentation over and over and over. Please do that, whether or not you just write down a number of stuff. I'm not saying for you to listen to me talk, but I'm saying for you to go and jot a lot of this down. Look under community resources. If you use the internet, which I did, I looked under community resources. All Orthopedic Association, Orthopedic Nurses Association, Rheumatology Association, Urology, Endocrinology, Podiatry. I want you to see what and any breakdowns of those associations. Did they have a support group? Like under Orthopedic Association, if you keep looking and going through the process, there may be a total knee support group, a total hip support group within your community that meets once a month or, quarterly. Be a part of that, okay? Community support solutions. This is another area you look for, okay? Community resources and then community support solutions area. Home health service, medical service, assisted living facilities. And on that, you will see, let's say, assisted living. There is groups or activities or social events that you will have access to. I went to a number of assisted living facilities during their recreation time just to show them ankle and lower leg exercises, range of motion. You are knowledgeable to do that. Please. And it gave me contact. A lot of times their family members would be there, and I would get to know them. Sometimes the doctors, the physical therapists in that area or in that facility would come, or the activity or recreation director. I actually, when I got into the doing some speaking for the assisted living, I talked to the recreational director and got involved in that manner. Okay? So don't always think you've got to contact the doctor. Online support groups, directory, I'm talking about the web link, national and international support groups, most with contacts for local chapters, providing help and support for a great variety of problems and conditions. Patient and community education. Now, if you type in patient and community education in Birmingham, Alabama, you're not going to believe what all comes up, okay? So it's amazing, and I spent time on jotting down. If there was a phone number there, I called that phone number and to see if they have any topics that's coming up. How can I help? I am wanting to make a difference in my community, okay? Weight loss surgery support groups, bariatric. There's a bariatric TV radio live every Monday night. They are looking for people to talk about shoes. A majority of the bariatric patients, some of them have not been able to wear shoes. So now they have lost 125 pounds and they're having problems about fitting a shape of a foot that has been swollen or fatty tissue, and it now is no longer. Now they're dealing with soft tissue pain or symptoms. A lot of this may be plantar fasciitis. So that way you can be a part of that. Adult and adolescent support groups of weight loss. There's so many, like Weight Watchers, there, that you can go in and contact or contact the person that's the head of the Weight Watchers group in your area or at the site of the meeting sites. Find out who is in charge. Invite them to your facility. Take them through what you do and tell them what your intentions are. Is to help people. Sure, you want to sell, but you want to help to educate. There's church weight loss groups. If you go to every church in your community that is large in number, there's going to be a weight loss support group. There's going to be church exercise groups, meditation church exercise groups, church recreation leagues. Get active in that. I know with the church recreation leagues, when I was very involved in starting up Pedorthic in Tuscaloosa at the University of Alabama, I contacted the recreation directors to see what was going on. Can I come and just give a talk to their coaches about stretching and to check their shoes, make sure the kids are lacing up their shoes, they should do this, blah, blah, blah. It got me in front of that group. It got me more exposure. Okay? Church senior group meetings, active aging group meetings. Then you have Overeaters Anonymous. This, you can call these people. Here is the website, and I did this for Judy in Seattle. There's the number. Call that number. Get to know who's on the other end and try to meet with them. Tell them what you have available. There's a number of support groups for seniors, just seniors in your area, and this is one that I did for Judy in Seattle, the arthritis and fibromyalgia. It gives you 2 sites, Bellevue and Kirkland of Seattle, but it also gives you a number here of who to call. Fibromyalgia support groups, living with fibromyalgia and chronic myofascial pain. That's where the covering or the lining of the muscle is contracted, and it actually changes your posture. And believe me, you've seen a lot of case studies I've done on myofascial contractures and how positive the outcome is, with just the shoes and the orthotics. There's a lot of fibromyalgia outreach foundations, and I just went ahead and pulled up some recent just to show you, and I took Central Florida. Fibromyalgia and pain. There's a meeting at the hospital resource building, every Tuesday at 7 o'clock. Contact the resource building. Who's in charge? Let's find out about that. Meet with local people. At this time, the meeting is to meet with local people who suffer from fibromyalgia to discuss, share, laugh, and conquer the misconceptions regarding the disabling condition and make a difference here in Central Florida. This is a group that would welcome your insight and education for them. Okay? Then you have a fibromyalgia meetup group near Orlando, Florida. Okay? It's alternative health and wellness. Diabetes support groups. The Defeat Diabetes Foundation provides a listing of diabetes education programs and peer support groups in all 50 states. So if you go to that website, you've got access to that. Don't think, well, what I'm doing for Diabetes Month is I'm going to advertise in the paper and I'm going to have a sign at the front of the store. No, that's not going to get it, people. You have to get out. You have to get in front of people. I know you've got a lot going on within that store, but I did it, and you're going to have to do it to be successful. There is a way. All you've got to do is take the first step. It will happen. It's not going to happen overnight, but believe me, those people are going to come in. If you're trying to do a good thing and to make a difference, it will happen. I know that. I believe that in my heart. Okay? I'm just going to click through some of these. Heart disease, the Mended Hearts Association. This is in Bellevue. This was in Seattle. The Mended Hearts, you're talking about some of the issues of post-open heart surgeries. A lot of open heart surgeries. Doctors advise walking. You want to talk to them about the contractures of the legs. Why is it important to have a shoe on, even if you're sitting at times, and exercise your feet? That may be an incorporation or application of a rocker sole shoe just to help with increase or pumping of the lower extremity. So these are so many things that you can get involved in. The Central Florida Cardiology Group Association. This is highly trained clinical support of the ART diagnostic equipment and our Orlando. But I would urge you to contact them, because even if you're wanting to be a part of a support group, they may say, well, I don't have anything going on, but I do know of a person that's the head of this group in Kalamazoo, and let's contact them because they're always looking for patients or looking for speakers. Brain aneurysm support group meetings. This is critical for you to get involved with this population because they have issues with balance and walking, and it also gets you in contact with their healthcare providers, their support groups, their physical therapy, occupational therapy, the stroke support groups, the CVA support groups, American Heart Association. If you go to that website, then you get into the aphasia support group website and stroke support groups. Stroke victims, there's a big group in Kissimmee, Rehabilitation and Sports Medicine, and they have monthly meetings. Brain injuries. I saw a number of referrals with brain injuries, and a lot of times I made a lot of contacts with the physical therapy hospital or association that actually treated only brain injuries, and I would do an in-service for them, or they may call about a patient. His family is with him at this time. We need to talk about supporting the right ankle because every time he tries to stand, he has no control over the right ankle. That actually goes into inversion, but they don't want to put him in an AFO. They would like to leave that free, but they want him to walk just for the healing process of his whole body. And I was called in on a lot of those consults. Amputee support groups within your area. This is a must. There's so many access. Go to community resources. That's where I found the amputee support groups. Parkinson's disease. I did a number of Parkinson presentations of groups to doctors, and what I did, I talked about balance. I talked about enhancing support and stability, therefore increasing or enhancing the dynamics of being more mobile. ALS. I saw a number of ALS patients that were still trying to be active, and staying active and being flexible with the Lou Gehrig's disease is so critical to this process. Post-polio support group, I was very active in writing articles for their newsletter, which came out 2 times a year. The other support groups, Scleroderma Foundation, Spina Bifida Association, Juvenile Diabetes, chronic pain support groups, and that got me into a lot of the chronic pain clinics. Charcot-Marie-Tooth disease support group. People are becoming more aware of this disease. Sjogren's and lupus support groups, little people support groups. There's a number of them in your area. I know that a lot of you know my personal journey. Started in sports medicine, opened up the first 2 sports medicine clinics in Alabama. I also owned a Total Approach athletic shoe store and aerobic apparel center. And I had an aerobic instructor upstairs over the facility. And so that way I knew I had a lot of flow going through my store before they got to their activities upstairs. And I held a lot of in-services there at the store just for people in the community, lawyers, pharmacists. It was phenomenal, the referral access that I had. Part-time faculty, I would teach at night some, plus the athletic shoe store was on the side. It was just something I wanted to do. I trained the person to run the facility because I was the sports medicine director of an orthopedic group and foot specialist. In 1991, now with all of this, you notice here I taught classes 1 night a week. I also owned a running shoe store that I would go and work at on Saturdays, and that's when I would see appointments. sports medicine director and foot specialist with University Orthopedics. That was during the day, okay? But in 1991, just to give you an idea, I presented 52 times to organized groups. It was my responsibility to start up the sports medicine center and the foot clinic that we initiated with the University Orthopedics. I did have the medical support because I was in with 4 other orthopedic physicians. But with that in mind, I went out and educated lay people. That's what I did. In 1993, I started the Pedorthic Care Center in Birmingham, Alabama. I ended up with 12 employees. I had 128 referring physicians consisting of the largest referral area of 28 states. I saw on average, my team, my people, I had trained Pedorthics. At this time, there was 2 other Pedorthics with me. We saw an average of 55 to 65 patients daily, new and follow-up. Average of 344 orthotic fabrications monthly. And we made the orthotics there in access in the lab. Education is the key to your communication. Education is the key to connecting and making a difference in someone's life. So all your personal contacts, your word of mouth, your demonstration to the medical community that I am an important and viable profession. I learned how to service and practice and market within my community aggressively by understanding how to stimulate communication, provided more profits in the business. Now let me go back to this, understanding how to stimulate communication. You've got it, if anybody's got it. I am just a country girl from Alabama, but believe me, I have had a wonderful, wonderful journey. Recognize everyone that came through my door and your door as an opportunity, a gift to further my education, learning from them and them learning from me, and increased my referral source. Documentation is so, so important. I initially started out handwriting, then I went to a dictaphone. I documented letters on business letterhead, listing staff members, and I always included my mission statement. Letter consisting of thanks to whom it may be concerned for this wonderful referral. And believe me, God is good. He gave me a lot of opportunities. Summary of service provided and your procedure of treatment and follow-up schedule. According to the referral diagnosis, an education brochure was always included going back to that referral source. And then whoever saw that patient was signed as practitioner's signature. So there again, identify your community, connect within your medical community. Strength. There's so many other areas like strength and conditioning. And when we talk about that, we're talking about aerobic instructors, personal trainers, sports performance specialists. And you're going to find the sports performance specialists a lot of times at University Connection. And that's going to get you into talking to the nursing class, the beginning nursing class, talking to them about the importance of their feet and their shoes, taking care of them. Sports facility managers, recreation managers, exercise physiology, physical educators. All of the organized school professions, like the School Nurses Association, this is a lot of time involved, and I spent a lot of time in educating some of the insurance programs, such as Blue Cross Blue Shield. What is Pedorthics? A lot of their case managers had no idea, what this is. I made myself available to call them, contact them when I was negotiating contracting with Blue Cross Blue Shield. Coaches Association, Umpire Association, Booster Club, they all need shoes. And even if you just go in and talk 10 minutes about, now I'm not saying take a shoe and say we sell this at Foot Solutions. I'm saying have case studies, 1 or 2 case studies, and you're showing from beginning to end the difference of what you do. Okay? Team Physician Association, Athletic Trainers Association, all state levels. And you know I've always said speaking is priceless. So this is just giving, and you can go back. I know that my time is getting limited here. I apologize. You know, I love to talk, obviously. But I'm so, I feel so much passion about this profession. And I'm very compassionate about the clients, the patients, and I just want to do my very best. And I expect the same out of you, and I'm not going to get any less. Do you hear me? Expectant Mothers Education, Fitness, sponsored. This is all sponsored by hospitals. OB/GYN Association. Get to know. There's expectant support groups in there, and there's daily meetings of the expectant mothers education groups, and you need to be a part of that. I always was, and I actually did a lot of case studies in evaluating mothers' feet after starting with pregnancy after 12 weeks and all the way up to post-delivery. And I would go and see them and contact them as to the difference. And it's phenomenal, the changes and the awareness that was for the OB that was working with her and everybody else involved. Marketing events, you know, the health fairs. Don't think health fairs can be very boring, but they can be priceless. I did them out of the wazoo, but what I did, I didn't go and just stand there with a brochure. I didn't even have a brochure. I had my card. But I had everything set up to bring attention to my booth. And by the time they left, I had a line. By the time it was over, I had a line waiting to get the individual in-service that I was actually giving to each individual, evaluating their feet, doing shoe evaluations, whatever. You know, just getting them, bringing attention to my site. But I love doing foot evaluations. I had the Harris mat and a lot of ink and a lot of paper. But people left there with my name and number and their foot evaluation, and I also kept a running list as to who I saw and also who their physicians were. And if I needed to contact them, if they were a diabetic and I saw a potential site, you better believe I called that physician that I just saw this patient at a health fair, and can I become a part of the treatment plan for this patient? These are the suggestions I would suggest for this patient. So organized senior groups, Woodmen of the World, and the reason why I say Woodmen of the World, my brother is a fraternal organizer national for Woodmen of the World, and there is 232 senior camps that go for 1 week, and usually in every state, and usually there's 4 or 5 camps within your state. So, and they always love for you to come and speak at one of their lunches. And, so I had access of over 100 seniors at one time. Special Olympics, Down syndrome, CP, cerebral palsy, I got very involved with that. These are some of the topics that a lot of people wanted me to talk on, was enhancing performance starting with the feet. Prevention, anything about prevention involving my area. Improve balance, stability, strength, range of motion by evaluating your feet. I was also available for in-home care. I did a lot of in-services for home health care providers. I contacted them, got to know them, the physical therapists, and the nurses. I was always available, whether I came after my business, after the business hours. I would always go by and talk to the patient. That way I always went by the nurses' station, and I got to know who they were. Now you see a lot of boot camps, and you need to know who are the instructors of the boot camps and actually what their main focus are. There's a lot of 5K and healthcare, fitness activities, and also, you know, we're getting ready for the MS 150 and the walk, the 50-mile walk for breast cancer, and there's a number of activities. I think LS has a walk. especially the people that are going to be walking 100 miles and starting a training a time, and these people meet at an organized time. I was available to go and speak to them. They would usually meet like at 7 o'clock at night, and I just gave a short awareness information presentation on blisters and socks and the types of shoes, and I also evaluated their feet while I was there and gave them suggestions. Again, a weight loss type and fitness activity, weight loss retreats, contact in your area, pregnancy meetups. These are very important. Living well with lupus meetups, and it also gives you the doctor that is usually involved with this. Contact that doctor and let them know how you want to become a part. There's also foot and ankle groups, such as with podiatry. I would contact them. I would open myself up that you want to learn from them. Window your way in to be a part. I was always very involved in the runners clubs, and I would a lot of times do guest speaking, but every time that I went, I did foot evaluations for them, and I always took shoes. And this is when I was a store owner. It was called the Total Approach shoe store, athletic shoe store, and where we did your foot evaluation and picked out the shoes for you. You never picked out the shoe yourself, looking for colors or anything along that line. I went with the individual needs of your feet. So that opened up, by doing that, going to running club functions. I would take shoes, do foot evaluations, and then my store manager would fit and sell the shoes right on the spot. And that proved to be very, very beneficial. Let me close with this. Value the customer and focus on the customer's needs. Bringing value to a person through a showing of kindness for others, genuine interest for others, their needs, and with the knowledge of foot care through the service you provide, you will gain the respect and the referrals of the medical community. Positive patient response will be translated to a prosperous, healthy business. Thank you all. God bless you all. I wish you the very best, and please let me know if you have any other needs or any questions about this. I'm available to you. Take care. Thank you. Bye-bye.
Thank you. Please stand by.